Hello everyone, and welcome to our OCD Awareness Week Assembly. OCD Awareness Week is taking place this year from the 13th to the 19th of October. This week is all about learning more about obsessive compulsive disorder, also known as OCD. We'll be building knowledge, busting common myths, and finding out where to get help and support if needed. So let's work together to break the stigma that can be associated with OCD and create a more understanding and inclusive community. So why do we have OCD Awareness Week? The purpose of OCD Awareness Week is to help people understand OCD. There are a lot of myths surrounding OCD which we will aim to have a look at during this assembly. Talking about OCD can help people to feel less alone and more supported, and it can help to reduce the stigma around OCD and around mental health. Stigma means judging or treating someone unfairly because of something they are going through. For example, a mental health problem. Stigma can make it difficult for people to talk about their experiences and reach out for help. So the more informed we are about topics such as OCD, the less stigma people will face. Understanding OCD means more people can get help sooner. This assembly is not about understanding every symptom of OCD or going through every treatment option, but it is about promoting understanding around OCD and providing shared language so that people who might be struggling may feel safe to speak up and talk to those around them who can help. When we know more, we can talk about it with more care, support those who might be struggling, and create a skill community where people feel safe to speak up. OCD stands for Obsessive Compulsive Disorder. OCD is a mental health condition where someone gets stuck in upsetting or unwanted thoughts, and these are called obsessions. To try and feel better or to try and stop something bad from happening, a person with OCD might feel they have to do certain actions or routines, and these are called compulsions. It's important to know that OCD is a mental illness. That means OCD is something a psychiatrist, who is a mental health doctor, diagnoses when a person's experiences match certain criteria. It's not just about being neat or liking things organised, it's much more than that. OCD can feel really tough and it can get in the way of school, friendships and everyday life. But it's important to know that with the right support and treatment, people with OCD can feel better and live full, happy lives. Being aware of how common OCD is and who it can affect can help to raise awareness and understanding that there may be people we are friends with, we go to school with, in our family, or wider community who could be impacted by the symptoms of OCD. Based on current estimates for the UK population, there are around 750,000 people living with OCD at any one time, and this is around 12 in every 1,000 people. In 2020, it was estimated that 3.1% of young people in Northern Ireland met the criteria to be diagnosed with OCD, and this is around 31 in every 1,000 young people. We know that 25% of people start to experience symptoms of OCD that are impacting their lives by the age of 14. And OCD impacts a range of people, from young children to adults, regardless of gender, social or cultural background. There is no specific cause for OCD. Research suggests that there are several factors that can contribute, including genetic, environmental and social factors. We are now going to bust some common myths around OCD. There are a lot of misconceptions out there, and myth busting helps us to talk about OCD more openly and respectfully. A statement that we might sometimes hear is that someone can be a little bit OCD, and this is a myth. OCD isn't just a word to describe being tidy or liking things a certain way. As I've said before, the D in OCD stands for disorder, which means it's a mental health condition that can have a significant impact on someone's life. We may also hear the phrase, "I'm so OCD," when someone is describing that they like things neat or organised, but OCD is much more than that. Using phrases like this can make it harder for people who are actually struggling to ask for help, because it adds to the misunderstanding and stigma around OCD.
Everyone basically always says, "Oh, I have OCD." Like, I'm so OCD and stuff, but it kind of gets annoying because they don't really understand how frustrating it can be and how harmful it can actually be to just in life trying to do things.
A lot of people are just with normal things, they're doing a project in class, they're like, oh, I need to finish that, I'm so OCD. And I just look at them you don't understand.
We're just talking about OCD randomly. They're like, oh yeah, I have OCD. And I just think to myself, no, you don't. You just think you do because you just have to have stuff perfect. But that's not always what OCD is about.
Another statement we might hear about OCD is that it is just about being super clean or tidy. But that's not true. OCD is about unwanted, upsetting thoughts and feeling like you have to do things to feel okay or to feel safe. For some people, that might include cleaning, but for some it might not. It's different for everyone. Misunderstanding OCD can lead to those who have OCD to feeling shame or feeling isolated, and this is why it is important that we are challenging these myths.
I would tell them that OCD doesn't just involve washing your hands or keeping things neat. I would tell them that it involves having these unwanted thoughts that make you do rituals such as washing your hands or keeping things neat in order to make yourself feel better because you have a fear of the thoughts that you're having.
To help promote our understanding of those living with OCD, it can be helpful to think of OCD like an iceberg. What people might notice, like someone washing their hands a lot or tapping, is just a small part, like the tip of the iceberg. Underneath the surface, there are the thoughts and worries that cause those actions or behaviours. These hidden parts that are often what makes OCD so difficult for the person living with the condition. Some people might think that people with OCD are just being fussy or picky, but that's not true. People with OCD don't do certain behaviours because they enjoy them or because they're being fussy. They feel like they have to do these things to try to stop upsetting thoughts or scary feelings. As I mentioned earlier, with OCD, these actions are called compulsions. Compulsions can be things we see, like hand washing or checking, but compulsions are not always obvious. They can also be mental acts like silently repeating words or someone counting in their head. Often people can feel stuck repeating these actions until the feeling of anxiety reduces or goes away. Doing these actions can take up a lot of someone's time and energy, impacting their life. For example, they might be late for school, or they might not be able to do the things that they want to do. Another myth is that people affected by OCD lack a sense of humour about OCD jokes. People with OCD do have a sense of humour. However, when people make jokes or say things about OCD that aren't true, it can make the condition seem less serious than it really is. For someone who's struggling with their symptoms, these jokes can be hurtful and can make it harder for them to talk about what they're going through and ask for help. Some people with OCD like to use humour when they talk about their experiences, and that's completely okay. Try to be thoughtful and respectful when talking about OCD. That way, you're contributing to breaking the stigma. The last myth that we will look at in this assembly is that OCD is something you can just snap out of. And again, this is not true. OCD is a serious condition. It's not something someone chooses to have. People who live with OCD usually need support and help to get better. It's not like you can just snap out of it or stop it whenever you want. The good news is that with the right treatment, people can recover and live well. Here's an exercise that might help you understand a little of what it is like to struggle with OCD. I want you to try to not think about a pink elephant. Don't think about a pink elephant. Don't picture a pink elephant with floppy ears and a long trunk. Don't imagine it dancing around in a pink tutu. Whatever you do, don't think about the pink elephant. Did anyone manage to stop thinking about the pink elephant? Probably not. This simple exercise demonstrates how hard it is to just stop thinking about something when someone tells you not to. Sometimes we get a thought stuck in our head, maybe an annoying or unpleasant thought, and that's totally normal. like when you have a song you dislike that you can't get out of your head for a while. Just because you have a thought doesn't mean it's true or something you should worry about. If you try to tell yourself, don't think about that, it usually doesn't work. Like with the pink elephant. It can help to do something to distract yourself or talk to a trusted adult about how you're feeling. But for someone with OCD, these upsetting thoughts don't go away after a while. They keep coming back and cause a lot of stress and worry and can make life feel very difficult. This is why the idea that someone with OCD can just snap out of it is a myth. They can't just tell themselves to stop thinking about these worrying thoughts. When these thoughts don't stop, it can feel overwhelming, and that's why support and understanding are so important. Having an unpleasant thought that sticks around in your mind, especially during a period of high stress, for example during exam week, is very normal. You will find out lots of information on how to manage stress through the Youth Wellness Web. If you feel that you're having thoughts that are upsetting or unhelpful, or making you feel like you need to behave in a certain way, help is available. The earlier that you seek support, the better. Just because you have maybe noticed some sticky thoughts or new behaviours does not mean you have OCD. You may just need some extra support to manage how you're feeling. There's lots of good information about OCD on OCD UK and the Young Minds website. Alternatively, speak to your school counsellor who will be able to help you with techniques to change your habits and cope with your thoughts. Your school counsellor might recommend that you visit your GP, who is your local doctor. Alternatively, you might decide to talk directly to your GP rather than speaking with a teacher or school counsellor first. Your GP can refer you to CAMS, which is the Child and Adolescent Mental Health Service, if they think you may require specialist mental health support. You may have to wait for your first CAMS appointment. There are CAMS teams across the different health and social care trusts in Northern Ireland, and wait times will vary based on where you live. The first step in the process is a CAMS assessment. If you meet the criteria for CAMS, you will co-design a treatment plan with your therapist and/or a child and adolescent psychiatrist. The plan might include cognitive behavioural therapy, which is also known as CBT, and sometimes medication. It is usually best for young people to try CBT before being assessed for medication. CBT can help people understand how our thoughts affect how we feel and what we do, thereby providing coping strategies to manage OCD and live a happy, full life. You can also find out more information on CAMS by scanning the QR code.
I've just learned that OCD is beatable and that you're not the only one. There's a lot of other kids dealing with it.
Here are some quotes from the Young Minds website, from young people who are living with OCD. The first young person said, "With the correct combination of professional treatment and support, people with OCD can improve their condition and recover." Another said, "When times are tough, know that whatever you're going through right now, it isn't permanent." And lastly, someone said, "Even though I was able to seek support and manage my symptoms, I can recognise that many others don't feel as though their worries are worth talking about." Often OCD can make you feel like your feelings don't matter, but they do. Here you will find some additional services where you can seek support. Please note, the information contained is intended to support emotional well-being. If you feel triggered or overwhelmed with any of the content or would like additional information, we encourage you to speak to a member of school staff, parent or guardian, or trusted adult. Thank you very much for listening.